they might ask, tell me about a time that you made a mistake and how you handled it. So basically the points for this are about a mistake that wasn't super critical, something kind of minor. Don't talk about like a med error or anything like that. And then you have to make it like a big deal in your head. You have to say like, it was really alarming to me because I realized it could have been so much worse. Let's say the situation had involved a medication or something like that, that, I really need to, going forward, I need to do this thing and do this thing. And so I always do this. And it has really helped me improve. And I'm so grateful that this was brought to my attention. And that nurses are allowed to openly share their mistakes. I love when my preceptors talk to me about past mistakes that they've made, because it really helps us put the patient first and that kind of thing.
Okay. Yeah. Yeah. So this one time I was getting a new admit and I was trying to help take all the vitals and make that patient comfortable. And I just got blood pressure, heart rate, and pulse done with the vitals. And I was about to take the patient's temperature, and the patient asked me, "Oh, I need a pillow. Can you please get me one? I'm so uncomfortable." And I immediately put down the thermometer and was like, "Yes, yes, let me run and get that." So there was other people in the room, but my clinical instructor in the room, and I left the room immediately. I searched this whole unit for a pillow, and the thing about this unit is that it's not the most stocked unit on the planet. So I searched for 5 minutes. I couldn't even end up with a pillow, which is one of the worst parts. I came back without the pillow, and I apologized to him. I was like, "I'm so sorry. I'll find you one in 10 minutes. Our supply room is currently empty, but we'll get you one soon." And I took the patient's temperature. I got him situated. He was stable. And I had to go leave to do another task. But as I was about to leave, my clinical instructor, who was watching all this went down, flagged me over, and she just was like, "What did you do wrong?" And I was like, "Oh, well," and I kind of went through a laundry list of like, "Oh, should I have put on gloves at this point? Should I wash my hands?" And then she's like, "Nope, nope." And then finally I was like, "Should I have taken the patient's temperature before?" She's like, "Yes, you should have taken the temperature before you ran and got the pillow." And she just explained to me that vitals are really just important, especially when the patient first comes in. One, to have a baseline, which I knew, but two, that patient could have been running like 104 fever, and I could have been running around wasting time trying to find a pillow to make them comfortable, which is nice, but it's definitely not the priority thing to do in that situation. And I should have told him, "I will find you a pillow in a minute. Please let me just take your temperature." That situation really made me realize how important your initial assessment is. And especially in a critical care situation, I could have been getting anything. So as nice as it was that I ran around trying to find that pillow and I wanted to make him super comfortable, and it was a situation where I was allowed to make that mistake because the patient was stable in the minute, and my instructor could see that and wanted me to make the mistake so I remember. It's good to know, because in that future, I might not have the patient who's stable in that moment, and I should always make sure to just do my assessment first before doing any extra stuff for the patient.
I love that. Maybe because sometimes they'll say to you, like, "I'm not just something to check off your to-do list. Like, you can't just come in here gangbusters and I don't care about your to-do list," kind of thing. So instead of like, "Let me just take this temperature," you could say, "Let me just make sure you don't have the temperature." So it's sort of like something you're doing for them to keep them safe, rather than something you
Yeah.
need to get done before you do other stuff, kind of thing. And then
Yeah.
maybe it comes out better because it's something you're doing for them just to make sure they're okay, kind of thing.
Yeah. Yeah.
Um,
That's right.
And you can use this for a time that you got constructive feedback.
Yeah, that was gonna be my same story.
Yeah. So what if they ask you, please tell us about a time that you made a mistake and how you took accountability for it?
Okay. Could it be like a near miss mistake
Yeah.
kind of? Okay.
As long as you
Um,
say at the end, like, you know, that you realize you're grateful for that learning opportunity because you realize it could have been so much worse because of this and that reason. And so in the future, you're going to do X, Y, and Z to make sure your patients are safe.
okay.
Yeah.
Um, let's see here. Okay. I had a patient or I had a nurse go and tell me to get a urine sample from a patient. So I went, we had two patients in one room. We had bed A and bed B. She told me to go get a urine sample from bed A and gave me the patient's first and last name. And when I went in there, I realized that they had antibiotics running. And I was kind of like, okay, well, if I learned anything in nursing school, it was take their urine sample before antibiotics are given. So in that moment, I was kind of confused. And my nurse was really, really busy that day. So I kind of just took it upon myself. I'm like, all right, well, this just doesn't make sense to me. So let me just pull up the chart myself and see what's going on. And out of the 4 patients we had, we only had 1 patient that needed a urine sample for a possible UTI. And that was the patient in bed B. So I ended up going and just double checking with the nurse. I was like, hey, you said bed A in this patient. I just want to make sure because in the chart it's for bed B. And she's like, oh, yeah, that was my mistake. So I ended up taking the urine sample from bed B instead. But I guess the thing that I learned from that is to always do my own research because I could have just gone in there, taken that urine sample from that patient, sent it out to the labs, and it would have been a waste of everybody's time. So from that moment, I remember like if someone told me to do something, let me pull up the chart first. Like even if it was just feeding a patient, I'm like, let me make sure this patient is even allowed to eat and which kind of diet they're on. So that definitely made me more aware.
Yeah, I like that. And like just to kind of humble it up a little bit, you could say something like, as a new grad, there's so much that I'll need to learn.
Okay.
And it'll be a time where I need to be especially careful not to just rely on
A supervisor or something like that, or a mentor,
or maybe
maybe.
you can say it'll be a time where it's especially important for me to look at my orders, look at the policies and procedures, um, and to remember that, even though there are people who I I'll need for them to um, kind of share their knowledge with me, I'm ultimately responsible because
Mhm.
um, if mistakes are made, it can really hurt people. So
Yeah.
while I'm still being a sponge and learning everything I can from anyone who's willing to share their knowledge with me, I do still need to be really careful and double check.
Okay.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube. Can you please tell us about a mistake that you made in your clinical experiences and how you took accountability for it?
Yes, I have one from when I was a medical assistant, like before
Okay.
I learned like this, like the 9 rights, to medication administration and went through nursing school. I was actually giving an injection. There was 2 injections that were the rooms right next to each other, and they both were receiving a Toradol injection. Not that it mattered, but they were labeled um, with their name and date of birth. And I went into the room when I was going to give the injection, and I noticed that it was for the other patient. And I immediately got myself and was like absolutely mortified that I even did that. But it's the same injection, not that that matters, but it just really made me never made that mistake again. I'm super hard on myself about double checking, triple checking, because I never want to make that mistake again.
Yeah.
So I'm kind of glad that happened in a way, because now I know I'll never make that mistake again.
Yeah, so this critical mistake that I've made during my experience was I was on the floor with my nurse, and there was a code blue, and one of the patients that I didn't have went into cardiac arrest. So all the nurses immediately rushed into the room, and then my nurse kind of threw me in there and said, "You're gonna start giving chest compressions." So I immediately hopped in there, and after the first nurse gave his set, I hopped in after, and after that, when the patient got stabilized and everything, my nurse sat down with me and said, "You weren't going deep enough." And I told him my thought process of how it was a frail, older, elderly patient. So I thought that you wouldn't want to go as hard or as deep because usually in any other intervention you want to be gentle with things. But that was kind of the first experience for me to do something more vigorous and more stressful. And the only experience I've ever had before that was with a dummy. So every time I give chest compressions now, I always know it's 2 inches, no matter what. And I kind of use any critical mistake or any bad experience I've had as a stepping stone to, future success. Because anytime I'll give chest compressions now, I'll never forget that. And I know it's hard to be, or it's easy just to be hard on yourself, but at the end of the day, you're always going to be learning, no matter if it's your first year of nursing or like your fourth year of nursing. So I know that it's important to just keep my head in the game and always just keep learning and keep open mind. So
Don't change anything about that. That was perfect.
all right.
Love
I
that.
got you.
Can you please tell us about a mistake that you've made in your clinical experiences and how you took accountability for it?
Yes, a mistake that I made is I had a non-COVID patient and he got a COVID swab ordered for him because he had a procedure coming up. And so I went into his room to do the COVID swab and I told him about the swab and I got his consent and we did it. And after it was done, I labeled it with a sticker on and then I sent it to lab. However, my WOW station had multiple different patient sticker charts on it. And so after I sent the specimen to the lab, I realized that one of the patient's charts was missing a sticker that shouldn't have been missing a sticker. And I started to think and realized quite quickly that I had put the wrong patient sticker on the COVID specimen. And so immediately I called the lab and I explained the situation and I apologized. I said I was really sorry that I had sent it to them and that if there was any way that they could dispose of it and I would collect a new one. And they said that they understood and that they really appreciated me letting them know. And then I then looped in my charge and I let her know what happened and apologized to her as well. And I then went to the patient and explained the situation and apologized. And the patient, thankfully, was just super understanding and they said that they understood and they allowed me to do another specimen, which I was just really thankful for. And so I ended up doing another specimen, and you bet that time I put on the right label and I sent it to the lab. And moving forward, what I learned from that is to always just double, triple, and quadruple check everything. It was a great reminder to be very vigilant in everything that I do. And to this day, I'm always double checking my stickers.
Okay. Another thing you could mention is like, I don't know if they do incident reports where you were working.
Oh,
You know what I'm
yeah,
talking
they
about?
do. Yeah. So say just like collaborating with the charge to file an incident report.
Yeah. Yeah.
Okay.
Because basically it just helps, like, I'm sure you're probably not the only nurse that's ever like made that confusion based on like how the system was set up. And so like if they get a bunch of incident reports, they're like, oh my gosh, all these nurses are making this same kind of mistake because we have it so that they can print. Like you shouldn't even be able to print like the wrong sticker. You know what I mean? It should just be like you scan in before any of your stickers are available, you know?
When I was in the NICU, I was doing my round of cares or whatever. And so I did all the cares on the baby, including, changing her diaper and all that kind of stuff. And then after the fact, my preceptor was like, oh, you weren't supposed to do that because you were supposed to wait until the family was there because they really wanted to be a part of it. And that was in the notes or whatever. And so to be sure to look in the chart. I don't know.
Yeah. Or you could kind of give the back history first, whoever had decided that and what had been decided, and that you hadn't spent enough time. Like you were so excited to just do the cares and like be really hands-on that you hadn't done your due diligence of really going through the nitty-gritty of the note. And it taught you very early on that you like to get there early and go through the note. That way, before you even touch the patient, you know exactly what the plan is and all the considerations and how to balance all the patient's needs. And for example, let's say that the note had said that they were stopping a certain medication today and care got delayed because you gave it without reading the note, that you just went based on the MAR. Like you like to take at least 5-10 minutes per patient before you start to work with them to really understand just at least what's in the note, in your orders.
Mm-hmm.
Yeah, I think that's fine. And you can maybe talk about how upset the family was. where like the or whoever was upset and that you had to apologize and you realized that this was, if you had read the note, this wouldn't have happened. And you can dramatize it, that, you know, that there was no excuse or whatever. I don't know.
Yeah.
Okay, cool.
Is it fine if there was like, so like my example would be like I accidentally sent a lactic acid level without ice?
Yeah.
Okay. So it was one of my first days in the, and I was helping triage this patient and draw labs with my preceptor. He was receiving report from fire as I was inserting IVs and drawing labs. So I quickly got my labs and sent them to, because we were doing a sepsis protocol workup. So I sent my labs to the laboratory, and after I sent them, I immediately realized I forgot to put the lactic acid on ice. And this is something that I know can cause false highs on the labs, which may indicate a different medication for the patient or extra medications for the patient that they may not need in the first place. So I immediately went to my preceptor. I told him that I forgot to put the lactic acid on ice and I was going straight to call the laboratory. So I went on the phone, I called the laboratory and told them that I forgot to put the lactic acid on ice. Please do not use this lab and discard it. I'm going to redraw one right now and I'll send it in as fast as possible. And I then went back to the room, informed the patient that I needed to redraw the lactic acid level. And I remembered to bring ice before I even walked in that room. And I sent that lab right after. And I learned from this that it's important to not only speak up if a mistake is made, because that could put either that could be putting the patient at harm or be indicating treatment that the patient may not need in the first place. And as a new grad, I'm going to be constantly learning, and it is possible that mistakes will happen, but it is how you go about those mistakes and how you hold yourself accountable. And for me, integrity is super important to me. I will do the right thing even when no one's watching. I will do the right thing when I do make a mistake and never be afraid to speak up. And I will do the right thing even in the face of adversity. And that is something that I truly learned from this experience. Like something like that.
You can't, it felt a little like
I don't know what to say.
super impassioned at the end. Yeah, the other thing you could mention too is, you know, it was uncomfortable for the patient to have to be drawn again. And
For what?
what's that? Oh, uncomfortable because the patient had to get poked twice, right? And they have to hear
IV.
what's that? Oh, from his IV.
Yeah.
Oh, okay. That makes it a little bit better. The other thing too is like, you know, let's say it had been a 24-hour urine collection that hadn't been on ice and you had to like start the whole 24 hours again. That would have been like a way worse delay in care. So you like to read your orders really carefully to make sure that you're doing them right, whether it be about a specimen draw or, you know, especially medications or anything like that.
Okay, so what else should I add that like this is super important? Because if it were something like a 24-hour urine collection or a medication, it's super important to, I guess it wasn't on the orders though. It's like you always put it on ice. When we like drew labs, like we don't look at orders. If it's like a septic patient, you do a full rainbow and a lactic.
And you just know that from your policy or your procedure? How do you know that?
I think it's on it, but my preceptor just taught me it's like I think it's like the sepsis bundle policy.
Oh,
of
okay.
And it's like you start 2 IVs, you do this, you draw a full rainbow with the lactic. I don't know where it says you have to put it on ice, but I just remember my preceptor always said, put it on ice, put it on ice, always put it on ice. If you don't put it on ice, then you're gonna redraw it.
Yeah, you could just say there are labs that have very specific requirements, like putting the lactate on ice, or let's say it had been a blood gas that didn't get to the lab in 15 minutes, or if it was a 24-hour urine collection and I just didn't put it on ice. Both of those things could delay care. And in the case of the urine, it would have been like a 24-hour delay in care, which is harmful for patients. So while it was embarrassing that I had to call the lab and apologize to the patient, let them know that I had made this mistake, making the mistake early on in my career made me very careful to make sure that I'm being super accurate with specimens that have special requirements.
Yeah.
Okay, cool.
During my first rotation, when I was just a new nursing student, I was about to flush an IV line, and then I accidentally, when you have to remove the air in the IV and the normal saline flush, so I accidentally squirted the normal saline to my patient. So what I did is, yeah, so what I did is I apologized, and then I apologized to the patient, but luckily the patient just brushed it off and she just laughed about it, like, it's okay, you just give me a shower. But then after that event, my nurse preceptor pulled me aside and said, well, you see what happened, you have to make sure you work on your when you're pulling the plunger and removing the air out of that normal saline flush. And I said, yeah, and I admit it's my fault. I should have practiced before I even do that. And after that, I make sure that I take that constructive feedback. So I always practice. I even like borrowed like a empty syringe and put water up in my home and practice like removing the plunger. And so I could improve my skills.
Cute. If you pull down first, you break the seal,
Pull
and then
down
you
first.
have more control to go up without it being like it won't go, and then all of a sudden it goes like crazy.
I was so embarrassed during that time. You can tell my face was so red, like, because the normal saline was splashing all over my patient. I was doing the IV insertion for my patient, so I could draw blood for the lab works, and also we can use that access to give medication. So one time, because I was still not that confident with my skills, so when I inserted the needle on the patient's forearm, so I think my angulation is wrong, is incorrect. So I put it very steeply. So I should have just lowered it down a little bit, because so what my nurse preceptor did is like, so he told me like, okay, I'll take over for this one for you. And then after finishing that IV access for my patient, and my patients move on, so she pulled me aside and told me about it. Well, I know you're very eager to learn, but I think you need to work on your angulation, because that is the wrong way. Because you might poke the, like, go through and through when you put the needle. If I put it too steep, I can push the needle through and through and miss the vein. So, and I said, actually, you're right. I told my nurse preceptor, actually, you're right. I should practice more. And but is it okay if you show me like how's the proper way? It's like, we took out another extra set of IV, and then we practiced on a like IV tube. So I practiced how to properly insert the IV there. And then also my school provides the open lab. So when I don't have any clinical, I always attend the open lab every Monday, and I practice on the mannequins right there. So I took this opportunity, this constructive feedback, so I could improve myself and my skills. And I think I can use this as a new grad nurse. I can show to you that the nurse that you see right now is not going to be the same nurse that you're going to have in the future if ever you hire me, because I've committed myself to improve every time, and I'm very receptive to constructive feedback.
I had this Spanish speaking patient who had on her femur, and I knew that. And when I passed by her bed, a room, I noticed her crying on the bed, and she was really limited in English. And because she was crying, first thing it came to my mind was pain. So I accidentally, that was a mistake I made. I asked her if she was in pain, and she nodded. So I called the nurse, and nurse came in with the nursing assistant who speaks Spanish because she knew about this patient. And when they had a conversation, no, she was not in pain. She was actually just missing the home. And I basically kind of disturbed everybody's workplace. And I felt really bad. I apologized to the patient, and she was okay. She said she's okay. She knew I was just trying to care for her. And I also apologized to my nurse and nursing assistant. I'm so sorry, sorry for disturbing their routine work. And they were okay. But I also assessed my own, doing. And I realized that I made a wrong assumption. And I really should not make assumption without assessing the patient. And she could have said that, I'm not in pain. I'm sure her English was not that limited. So that was my mistake. And from there on, I'm really being careful not to bring my assumption. I will really I do assessment by using their patient's own words. So that's something I learned from this experience.
Okay. You can also mention,
Mhm.
it's hard to tell, like, could you say something about using the translator, or is her English like not bad enough that she needed it? It's kind of hard for me to tell.
It was really limited. I could use that's the thing about ESL. I think it's good for me to know what kind of words they know. So I could communicate enough to tell her what I was going to do or something like that. But yeah, she was quite limited. I think she was crying and I kind of panicked at the same time. But if I asked her, probably she could say, I don't know if she's going to say she was missing family, but she could say something to let me know.
Maybe say, that you're gonna go find the translator machine just to make sure
Yeah,
if you think it
yeah,
might be a language barrier.
right. It was for sure. Yeah, that's what I should do. Yeah.
Yeah.
Okay.
Because just saying, do you have pain? If she says yes, that is your assessment, you did the right thing.
Yeah, I just kind of assessed. I don't know. I felt like
You feel like you projected it onto her, huh?
I feel like I just made a wrong assumption.
Yeah.
I kind of made a judgment before I asked her. That's how I felt like. I
Yeah.
should say, "Oh, are you okay? How are you? Are you feeling? Any pain? Maybe." But I said, "Are you in pain?" That's the first thing I said. And I was like, why did I do that? So.
I think this is good. Just add the piece about using the translator whenever you're like not
Connect them, yeah.
100% sure
Mhm.
that they don't need it.
Yeah, I should
Just to kind of like respect their rights,
Right. I think if she wasn't crying, probably I did, but yeah, it was like, was that the third or fourth shift? So I was like, oh my God.
Like the main points from this question come from your ability to take accountability and make changes.
Okay.
So, you took accountability and you're going to make changes, and so you'll get full points.
Okay. Yeah, I think like take a responsibility and what's the thing? And don't blame other people, something like that. So
yeah, 100%.
Okay. Try to be careful with it. Yeah. I don't think I blame other people.
Some people answer this question and the end of their answer is, well, see, because of how the story ended, technically I did not make a mistake. And they think that it's good because they didn't make a mistake, but it's actually no. For this question, it's about taking accountability. So they don't get the points.
That's not good.
Yeah. So no, this is perfect.
Early on in my practicum, there was like an IV pump that went off. And my preceptor was like, oh, can you check the IV pump and see what it says? And it was like volume near end was the alarm. And I silenced the alarm and just was trying to figure out, is there volume in the bag? What's going on? And then I can't remember what it was, but there was something else in the room that like immediately caught my attention and I needed to do. And I forgot that I had silenced the alarm. And so my nurse came in when it alarmed again, like a minute later, and she was like, oh, what was the deal? And so she explained to me why it's really important to address that IV pump so quickly. I think the miscommunication was maybe like the urgency about the IV pump. And the reasoning for that is it would go into KVO mode if the bag was still had fluid running through it. And so the fluid that was running was dobutamine. It's a vasoactive medication, inotrope. And so, we obviously want that to be a very set rate, and KVO mode is just like a standard whatever. And so that's either way too high, way too low for the patient. And so we want to make sure that we prevent that from happening. And then if there's not volume, then the tubing runs dry and the patient doesn't get the medication. And so I learned a really valuable lesson. And so there's volume in the bag. So she just showed me how to add volume back to the pump. And I learned a lot about that. But that was kind of my example. I don't know if that's enough miscommunication.
You could use that for a miscommunication. You could use that for a time you made a mistake, a time you got feedback.